thoracic vertebrae, right? So same thing here. If I said to you T9, that tells us thoracic vertebrae number 9, right? So T9. So we'll always give the abbreviation for the region and then the vertebrae number. What's the name of the low back? People have low back pain. They have lumbar, right? Lumbar pain. So lumbar would be 5 vertebrae, and we would say like L5. Okay. So 7 cervical vertebrae, 12 thoracic, 5 lumbar. The sacrum, which I don't even have here, we'll do that after, I guess. All right, so just for those regions of the spine now, I'll get into the sacrum a little bit later. All right, so 7 cervical, 12 thoracic, 5 lumbar. The next thing in the notes, guys, is that each vertebrae, if you take a look at the spine that we have intact in front of you, has a little cushion, a fibrocartilage disc called the intervertebral disc. So I want to show you real quick the anatomy of the intervertebral disc. If you remember when we did tissues, we said that all the discs in our body are fibrocartilage, right? It's a type of cartilage. So I want you to think of a disc like this. It's kind of oval in shape, and it has rings of fibrocartilage. All this here is fibrocartilage. Draw a couple more. And then in the middle is a ball of jelly. So it's like if you went to Dunkin' Donuts on the way to school today and you picked up a jelly donut. That's like the anatomy of the disc. The dough of the donut is the fibrocartilage, and then the jelly inside the donut, let's say grape jelly or something like that, would be this stuff. So instead of calling this dough, we're going to call this the annulus fibrosus. Right? It's just rings of fibrocartilage. In the middle, it's about the consistency of toothpaste. Is like a jelly that we call the nucleus pulposus. Right, so those of you going into orthopedics or physical therapy, that type of thing, even x-ray, because an MRI or CAT scan, you can actually look at the anatomy of the disc. When somebody has a disc injury, this is what it actually looks like. You'll have the annulus fibrosus and the nucleus pulposus in the middle. When somebody has, did you ever hear somebody having like a slip disc or a herniated disc maybe? Watch what happens here. Sometimes the annular cartilage will tear a little bit like this. Say you have like a tear. Now the ball of jelly moves into that tear and it's over here. It's not in the middle of the jelly donut anymore, and it causes this, like a bulging out over here, like it sticks out, and maybe a nerve going down into